Hi guys, I decided to help you out a little bit on the final and create some short, like little mini lecture videos for you, just specific to the final. As you know, the final is a culmination of all the chapters, so 1 through 10. So I kind of took all the content that will be covered in the final exam for all those 100 questions, kind of group them into categories, and I'll do a few little mini videos so you can choose which topic you want to review. It may make it easier to listen to. So the quickest way to get that to you is no slides, no PowerPoints or anything. So it's just me talking. So hopefully you can just listen. There's nothing to really see on the screen. So the first one is infection control. So at clinical, you've seen how important infection control is. Standard precautions, we use that for every single resident. So standard precautions applies to every resident. It's not just for people that look sick, it's for everybody. Speaking of standard precautions, which includes gloves, disposable gloves can only be worn one time. So we don't wash our gloves, we don't do a task and then move to another resident wearing the same gloves. Disposable gloves are worn only one time. We take them off, we throw them away. For hand washing, you all are pros at hand washing right now. 20 seconds of friction. So, wet your hands, point them downward. When you apply the soap, you're rubbing for at least 20 seconds. So you can go more than 20 seconds. You wash before and after touching a resident, of course. You can also use alcohol-based sanitizer if it's not visibly soiled. You do need to know about microorganisms and the kind of environments that they thrive in, and that is a dark environment, so dark or even moist environments, but just know in dark environments is where microorganisms grow and thrive, and we don't want those. So PPE, so for those of you that went into the room that you needed enhanced barrier precautions, or if we would have cared for somebody with airborne precautions or contact precautions, we would be wearing a gown, right? So how do we doff or remove a gown? We know how to don because that's a credentia skill. So to remove a gown, we unfasten the neck and the waist, then we roll the dirty side inward and away from our body, and that prevents contamination. Now, transmission-based precautions, so that would be like the airborne contact precautions, for instance, they're used along with or in addition to standard precautions. So it's not instead of, it's in addition to. Transmission-based precautions are used in addition to or along with standard precautions. Anytime there is a risk of blood exposure, you want to wear gloves, and an example would be shaving. If you're shaving somebody, you want to wear gloves. Gloves are mandatory then. In healthcare, for something to be considered clean, that means that it's free of pathogens. We don't just rinse something or look at it and say it's clean. It has to be free of pathogens to be considered clean. So just to recap, infection control, then just know the correct way to remove a gown, how often we can wear disposable gloves. It's just once, at least 20 seconds of friction when hand washing. We use standard precautions with every single person we care for. We wash our hands before and after touching a resident. Microorganisms thrive in dark settings. Let's see, wear gloves for any time we may have exposure to blood, such as shaving a resident. And in healthcare, when we say clean, when we say an object is clean, it means that it's free of pathogens. And we use transmission-based precautions in addition to standard precautions.